audition, filling positions, looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action already.
Good morning, everyone, good morning. And Maritza, was that you? You're ready to get into the vibe?
Yes, I'm feeling the vibe. The music
vibe.
is nice.
Zach Carlin is my music composer, and I had the pleasure of teaching for 2 semesters at Gateway, and it was public speaking course, and that was part of Zach's assignment. So rather than writing something, he composed this piece for me.
Well, I love it.
And I've been playing it for like 5 or 6 years, so I owe him big time residuals. I mean, major residuals.
Yes, let him know that I love it.
But I've gotten so much positive feedback because it's the message. His message kind of expresses exactly what the show is trying to has been. I shouldn't say trying, has been achieving. Let's be present. Let's be active. Let's be healthy. Let's not be discouraged. We're going to be discouraged from time to time, but don't let it be a constant vibe. But pull on your better angels. So it's really so inspirational for me to hear it after 5 or 6 years. I still enjoyed. My guest this morning is Maritza Bond, director of the New Haven Health Department. And we're going to talk about a few things. I mean, obviously it's the holiday season and vaccine and how can folks kind of participate and stay healthy. And we hear these words, COVID and flu, which are very much in our reality, and also about resources. But it seems to me, Maritza, that although we're going to mention about the emphasis on the holiday season, that you're 24/7, 365. It's important for people to understand that the season of health is constant, not just a season or just not episodic or just not when you go out or go in, but staying healthy should be your preoccupation as a season, in spite of snow on the ground, but let's jump in. I mean, it is the holiday season, and New Haven Health Department is really focused on making sure that people, as I say, stay healthy 24/7, 365. But what are you up to this particular time and space?
Yeah, absolutely. Well, thank you for having me again. It's such a pleasure to always be in your presence, especially a longtime leader in the community and all the work that you do and advocacy efforts and really addressing a lot of the disparities and bringing them to the forefront. So thank you for the work that you do for us in the community as well. For us at the health department, you're right. Our health is like should be our priority at all times. But we all know that in reality, there's always these competing factors, life that happens. And so making sure that it stays as our central point, especially as we enter the holiday season. Like, look how far we have now come from COVID pandemic, right? We did not have all of the therapeutic medicine and vaccines and resources at our disposal, like masks and test kits. And now we do. And as we enter the holiday season, it's going to be important for us to remind the community about definitely getting into that, holiday spirit and socializing, but being responsible at the same time. So we are kicking off this Vaxgiving holiday campaign. Really excited about it. My team have put together a campaign to really involve the community on the importance of getting vaccinated.
So tell us, don't leave us hanging. Tell us all about it.
So absolutely. So the Vaxgiving holiday photo campaign is a campaign which I myself participated. We're asking New Haven residents to submit a family photo of individuals either at a table or a holiday gathering that are vaccinated, and be entered into being able to get a chance to win different prizes that we have available for our residents. So of course, we love to really represent the community. This is for the community and by the community. So when the photos are entered, we are putting them on billboard or commercials and our websites. So we are entering them in different parts of our media efforts and highlighting our families because it is a time for us to gather together, build those memories, but most importantly, protect ourselves from the different respiratory diseases that we're seeing in the community.
And should folks go to nhvvax.org to where should they
Yes.
see?
So the campaign is on until December 26th. So please submit your photos. We have different winners that we will be announcing throughout, and your chance to also be on a number of different billboards, as I mentioned, and/or commercials that we are putting together. And so we certainly want to get the community involved and also show that we are getting vaccinated in New Haven and being
Mm-hmm.
able to protect our families.
And so good. So again, a person can submit their photos where?
They can visit the nhvvax.org and get the instructions on how to upload your photo. We are asking people to have it in JPEG format. So if you take it on your iPhone, that should be sufficient. And uploading that, and the instructions are right on the nhvvax.org.
Tremendous. I really like that. And how long, just out of curiosity, will the campaign and the billboards be up?
So it started November 29th and it's through December 26th, where we will be having the photo campaign running throughout the different platforms.
Hmm. I really like that. And you say you've participated yourself with your sons. I'm presuming that you have the
Yeah, with
picture
my
of
boys. Yeah, my
you and
two
your boys.
handsome young men. So we uploaded. I mean, obviously, I'm not gonna qualify for the prize. I'm exempt,
Okay.
but but certainly wanted to participate and we uploaded our photo. We've asked and encouraged our employees to do the same because the workforce is also part of the community. So definitely encourage. Hope that can be encouraging for me families to participate as well.
I like that. Who came up with the idea? Because we hear so much about social media. Sometimes we hear about the negative sides of it, and there's a reality to the temptations and how people use it for not positive reasons. But I really like that you're turning the table and kind of illustrating how we can use these new technologies for really a
Yeah,
total community benefit.
it's so important for me, throughout my career. I've always used this social marketing model. It's a best practice evidence, it's a evidence-based model that you really have to be able to engage the community on every single platform, both traditional and what's trending now. And so, we know that misinformation is also readily available through the
Mhm.
same exact platform. So we need to be able to stay ahead and be able to stay in tune where the community are really engaging, and we also do grassroots, right? So with our
Mhm.
different vaccine partners, we are making vaccines accessible to the community. So, this is definitely an effort that is a community driven effort with the different community partners. So getting right to the grassroots level, right at the neighborhood level as well. So, for us, it's important to reach communities through every single platform,
Right.
including yours.
And before we go to COVID and flu and updates in general, just curious, share a little bit about your partners. And also, I'm curious in this kind of campaign in 20, it'll be another year and I think 20 or so days. I'm curious what you're thinking from a marketing standpoint for 23. But share a little bit about your partners. So it's so important for people to hear how collaboration is really key.
Yeah, so this funding opportunity has certainly given us a chance to build together a health literacy initiative where we're really also being cognizant of making sure that the health information is easily understood. A lot of times we're throwing information at people that has a lot of jargon. And so we have partners like the Community Action Agency of New Haven, Cornell Scott Hill Health Corporation, Corsi and Company, Fairhaven Community Health Center, Housing Authority of New Haven, Elm City Communities, Micaria Media, Junta for Progression Action, many others. And so, the Board of Ed, our school system. So we certainly have come together as a community to making sure that we are collectively being, in partnership to making
Mhm.
sure that we reach those communities. And I think that's why New Haven has been so successful as an urban city is because we know how to come together for the betterment of the community we serve.
That's so key. And as you referenced at the top of the show, I have been around town for a few years and a few decades, but I got to tell you, in all transparency, it still is it's sometimes it gets somber about the are we being effective as a collaboration, but most days I can still find some distinct reasons for hope. And just when you're listed those organizations, you guys are a touch point. So you
Hmm.
may not people may just be seeing you for the first time, although I'm sure they probably have seen you in other campaign things. But Cornell Scott, when you mentioned AIM is the community action agency, so the touch points. There's so many Fairhaven Health Junta. There are touch points throughout the city that people can kind of they can solve this mystery. They can walk a healthy a
Hmm.
health a healthy walk. Um,
Yeah. And I think that's how we were able to get through the pandemic. In as a leader, you need to know when to serve as a convener. And oftentimes, as the health official for the city, I am convening partners together with my team. And I'm grateful for the team that I have to be able to bring these different partners together for, the core mission of protecting the health of the public.
let's just jump in about COVID and flu, and we might spend
Yeah.
10, 20, 30, whatever length of time is important just to talk about that issue because these respiratory illnesses, we have these historical terms now. I mean, the word COVID, right? No one knew about it until 2019. I mean, if you're a scientist, you knew about the word, but so moving forward for the future, we're going to have these words that indicate virus mutations for pretty much
Mhm.
the rest of our life. So, but give us a little COVID and flu update and prevention standpoint, et cetera.
Yeah, so as you know, we are certainly monitoring cases of all respiratory illnesses in the city, and certainly have seen a significant increase in both COVID and flu cases, not only in case rates but also hospitalizations. And
Mm,
so, really, are concerned where we are. We are encouraging individuals to be socially responsible. We already have all the resources at our disposal to be able to protect ourselves and our family members. And that is through mask wearing, making sure that if you're going to be in a setting or you have any type of respiratory symptoms but are negative from COVID, and also, hand washing techniques, social distancing when in large gatherings, and then also getting vaccinated or using therapeutic medicine to be able to recover from a respiratory illness. And so for us is really about not only getting vaccinated for an additional dose of COVID, but also considering a flu vaccine because we certainly are seeing the case rate, for example, for COVID right now, it's over 114 cases per 100,000 in our county, which has significantly jumped over 100%
mm,
in the last 2 weeks.
mm,
And those are cases of people getting tested with a PCR test, meaning in a clinical setting that goes through a laboratory. We know that people are getting tested at home with a rapid test, and that is not reported. So our numbers are
mm.
significantly higher than what I am seeing. Our flu cases are also significantly high. Really concerned about the hospitalization also increasing by 96% in the last 2 weeks, over 111 inpatients right now with just COVID alone, not including our flu cases and other respiratory illnesses. So, really, I want to just encourage the community to, you know, be cognizant of yes, gathering, yes, being in unity with your family and creating that bond, but also making sure that if you are developing symptoms or that you take those proper steps and measures to protecting yourself and others.
And because I do want to spend a few minutes on this I'll use the term rhythm, which is kind of neutral, but the uptick and the swings and the trends. But before I ask you more about that, for folks that want to kind of exercise take ownership of their own health, so to speak, in terms of flu vaccine clinics and testing locations, share a little bit about how people can access the clinics and
So
testing.
absolutely. So as I mentioned, we have vaccination sites throughout the city. We are actually partnering with 15 schools in the city of New Haven from 3 to 6 o'clock. We are also offering for staff between 1 and 3, and then the New Haven Health Department, as well as all of our vaccine providers that I mentioned. So nhvvax.org has a directory of all of the different neighborhoods that are offering vaccinations.
Mhm.
Most of them are without an appointment. The New Haven Health Department certainly is a walk-in between 9 to 5. And so the schedules do vary. So definitely check out the website. So depending on the location that is closest to you, individuals can be able to get the proper schedule.
Excellent. Let's spend 5 or so minutes on the trend line and the sometimes I listen to Bloomberg and about stocks going up and down, and people might follow their particular athletic teams about who's winning, who's losing. Uh,
Mhm.
but I'm just as you were talking about the uh, the increase since Thanksgiving, it seems to me you could be on a show every day and give a 5 minute report on what the trend line looks like. You've been involved with you were in Bridgeport before, you were in
Mhm.
other places in Connecticut and been involved with health in terms of even your academic background for several decades. I won't say
Mhm.
exactly how many. So what
22 years,
so
I
so
know, right?
so what does that tell you um, as you see these ups and downs and these swings? Are we as a human species just hard-headed, or is it just something that we have to always stay on top of?
There's always emerging diseases that we have to be concerned about, and then becoming aware of what those are and being able to know what measures we can take as an individual and as a community to be able to make the best decisions for our lifestyles and changes and behavior changes. And so, it is difficult because I think people grew weary of the pandemic. We were on lockdown for, a long period of time, and there was a lot of uncertainty, and now we have this, resources at our disposal, and we do certainly have our own individual responsibility. And that's why, as a social responsibility, I always put it back on the individual, is that we need to be responsible in, number one, getting the right information. Number two, getting the accessibility to vaccines and being able to protect yourselves and others. I mean, look what we're seeing with our, just the flu cases and RSV, for our infants,
Mhm.
and even COVID right now. And so we want to make sure that people know where to get those resources accessible to them, especially for free. Um, and that makes it easier for families to be able to, be able to not only have access but also make it affordable.
And it's as I have observed you in parts of your career, I've always been in admiration of your diplomatic and compassionate speech. But let me try to phrase my question another way. Is the uptick due to people kind of coming together for Thanksgiving in October? There was the predictions in the media that we would have this upswing, that we
And
would have.
it's just going to continue to rise. I mean, unfortunately, there are multiple viruses that we're seeing in the community, and largely has to do with the different um, gatherings that people are having, right? And so, and people being symptomatic and still, sending their children to school or
Hmm,
still going to work because people do not have other means to be able to have the time to take off. And so it's really critical that, if people are, having some respiratory illness and it's not COVID, to really practice those safety measures like wearing a mask. And people can, certainly get test kits from the schools. They can call us at the New Haven Health Department. We want to make sure that we make masks
hmm,
accessible to the community, because we want to try to minimize the cases as much as possible, especially our vulnerable communities like our children and our elderly, who often, have lower immune systems and are impacted
hmm.
negatively. And so for us, healthy individuals, we really need to be cognizant of, as we gather in the holiday season, we are only going to see, right now, we are projecting that the cases are going to significantly increase as we enter the holidays. That is a reality. And that is why we're really trying to do a campaign that brings in fun, but also reminds people that COVID is real, is still here, but we're also seeing flu cases and RSV in our community. And so there's multiple viruses that we're seeing. And we should be somewhat concerned, because it could impact us in being able to gather together if we're
Hmm.
not responsible.
Hmm. Hmm. And just in my comings and excuse me, in my comings and goings, I've talked to at least five or six mothers who's mentioned that their young child has has caught something, and they were just almost frantic with that reality.
Mm-hmm. And it is because, oftentimes, especially when you're dealing with young children and then having to go to the hospital, it can be, very concerning. And so, we encourage moms that have children over the 6 months old to get the flu vaccine for their children. We also now have the bivalent vaccine available for 6 months and up. So definitely contact your local pediatrician, consult with the pediatrician what's your best alternative options. But certainly, we know that historically vaccines have saved many lives and continue to do so. And so, we want to just get our families to participate with the Vaxgiving campaign. Let us come together as a community to show that in New Haven, in our Elm City, we do get vaccinated. And that is how we're going to continue to still be able to partake in these holiday festivities as we are entering them in the next week or so.
Let me ask you to repeat again. If I'm a mother or father and my young person is 6 months or older, you're recommending that I should do what?
You certainly can get the flu vaccine and also a COVID bivalent vaccine, which is the dose that protects with B4 and B5 variants. And so we certainly want to encourage our, mothers and caregivers of anyone 6 months and older. And co-administration of vaccine is certainly acceptable. Of course, you want to consult with your physician on what's the best alternative for you as an individual, because we know that different individuals have different circumstances. So certainly we are here for you to assist. Remember to visit nhvvax.org. We have all the information on how you can participate in the photo contest and be entered into a prize and be part of the media campaign, but also where to get access to additional doses if you haven't received an additional dose or a vaccine to get protected against the flu as well as COVID.
And that's so critical what I've just heard you say, because as we think historically, initially there was some discussion about whether you had to be over 12 or had to be over 15. Now we're saying 6 months or older, as early as 6
It was
months.
just approved last week by the FDA.
Oh, all right. Late breaking news.
It is
And
breaking news.
and talk elaborate a little bit more on that in terms of approvals and FDA. And there's a they didn't they the Food and Drug Administration did not flip a coin. They did not kind of like put their finger in the wind about this approval. There's a process to approve
It's a
something.
vigorous process in ensuring the protection of our community. And so the FDA did a vigorous process to approve the different vaccine vendors. And, the fact that it has been approved goes to show that we can go with confidence in getting vaccinated and being able to protect our children from having detrimental effects, because we know that individuals may still contract the flu or COVID-19, but we know that the symptoms will be much lesser than one who would not be vaccinated. And that has certainly proven to be a fact. And so we want to make sure that we are protecting our children from going into the hospitals. We are continuing to see those numbers steadily increase, and especially communities right now, we have over 100, as I mentioned, of COVID-19 alone, which does not include our flu cases that are in the hospital.
And I would urge, Maritza, during the 2019, 2020, I would talk to people and they would be, oh, this too will pass. And there's a reason to have faith. But then I'm always reminded of friends that I know that I literally have lost loved ones, have lost friends. I believe that you've mentioned on previous shows, someone in your family had your mother or someone had contracted COVID.
Yeah,
So,
yeah. So my grandmother and my
grandmother.
mother, yeah. And so, and that is exactly true. A lot of us have been impacted and lost loved ones, and in honor of their lives, that they did not have access to those vaccines early on. We should be able to, take them into consideration as we continue to journey on. So many lives, unfortunately, were lost untimely because of this deadly virus. And we want to make sure that we remind the community that the virus is still very relevant today. It has not gone away. Certainly, we are not regulating per se, because we now have resources at people's disposal. And so we want people to be able to take accountability of one's health and be able to get access to the resources that are really available at your fingertips for free. And
Mm-hmm.
so I think access and affordability is two things that, you know, as a mom that I care about. And I think it's important that people are aware that as a community, we have come together to make it accessible as a state. It is a priority even from the state down to
That's
here
right.
to the local level. And so we just want to encourage the community to, you know, as you're gathering, making sure that you get that additional dose and also a flu vaccine to get that double protection as we enter the holidays.
And you mentioned the schools also. They're
15 schools are participating in this campaign with us, and we're very grateful. You know, I want to give a shout out to the Board of Ed. They've been a tremendous supporter as we journey through the different components of this response effort, and always making sure that we are making it accessible right at the community level for schools.
and I mentioned that because we've heard in the press, and I'm stumbling here because there's people will hear in the media what they want to hear in spite of
Hmm.
the source trying to communicate information. But certainly, folks might have heard about absenteeism in the schools. But
Chronic absences, yeah.
some of that could be due to the kids not feeling
Yeah.
good.
Yeah, and so you know that's the balance that we're trying to have and assess, and it is a reality that unfortunately, you know, if a child is ill, they're not able, and they don't have a fever that's been cleared within 24 hours, they're not able to be in school, and so that certainly has played a role. But certainly, there's other data metrics that they're looking at. So hopefully, well, as they're having these community conversations, I think there's one tonight, um, they can be able to talk about what that data looks like to be able to take into account the absentees from being ill versus children just not being enrolled, and the fact that some children are not going to school. So definitely interested in seeing some of that data as they roll it out.
Indeed, and so just galvanizing the public in every way for us to kind of not only take ownership of your health, but to think about health of others, and even Maritza, talk about just as you were talking about the six months and older, even so daycare centers. I mean, if
Hmm? Well, daycare centers already mandate the flu vaccine, which is good.
okay,
So that's great. And, you know, daycare centers have been another instrumental way to be able to engage our, you know, daycare providers and informing them of our resources as well. So certainly, you know, we know I was a parent that utilized daycare services to be able to, you know, still have my career. And certainly my children were always getting some type of illness. Because you know they're
yeah,
gathering with other children,
right.
and so certainly the daycares have done a phenomenal job in putting safety measures in place, and I want to commend all of the daycare providers for their continuous efforts in just being flexible and adaptive to the different evolving changes as we make different recommendations.
Talk about this on the macro, the state and federal level. Maritza, just shift a little bit about your job. I'm always trying to desirous of communicating to the public that any public official, he or she, they're located in a particular position, have a particular job description, but there's also data coming to them from either the region or the state or
Mhm.
nationwide. Where's your kind of information network? Do you get emails every day from FDA or from your other
Yeah, so
peers?
you know, so as a local health official, you know, I've been a local health official in two major cities. Glad to be in the city where I was raised now, and been in public health for literally 22 years. And as an agent of the state, so as a local health official, we're an agent of the state. So we work in partnership with the commissioner of the Department of Public Health and get a lot of information from the state. But we also, on as a statewide and as the Connecticut Association of Directors of Health, participate at the national level
Mm-hmm.
to be able to gauge information both from the federal and also from our national state, you know, other state leaders coming together. And so certainly participating on a number of listservs where information is constantly fluid and coming from different resources, but certainly meet with the state at least once a week to really stay up to date on infectious diseases, because there's a number of other infectious diseases
Mm.
that I have to monitor in the city, um, in addition to COVID. And so making sure that we have a good understanding of that as well, and being able to then bring resources to the community to address other potential infectious diseases, like, as you know, monkeypox was something that was impacting us this past summer. And thankfully, we are seeing that those cases have leveled down, and grateful for that, but certainly had to ensure that we build an infrastructure for that and
Mm-hmm.
staying up to
Mm-hmm.
date on. I participate now on a national call on monkeypox to stay up to
Mm.
date. So certainly on a number of different platforms where, as the health officials, we stay up to date so that we can have the latest information that is scientifically based, and then making sure that we break it down as a level that can be easily understood for our community, both from the culture, the language, and literacy levels, because we know that medical jargon can be confusing, right? And so our job is to filter that down. And I have a great, health literacy team that has been working with our community partners in vetting that content once we get it.
Tremendous, tremendous. I mean, that's so important for people to know. Let's stay on the analytics for a second. Is it true that in terms of your, diagnosing where trend lines are, like wastewater or what? The,
So I look at a couple of platforms. So I have an epi team, which I'm grateful for as well. And we look at wastewater. CDC has a public portal where we are now doing New Haven County wastewater reporting, and we look at it from a county base. And then we have our Yale partner that also does the local level. But looking at the county base is something that's consistent with also looking at our CDC, where we also look at the case rate. But the wastewater is, for me, one of the best tools to look at, because it's actual
mm,
cases, because it's cases of people tested and not tested, right? It's actual, unfortunate, it's sewage, a wastewater,
right.
so that we're looking at it at the concentration levels, and then it can give us real data. So I am obsessed with wastewater data, because that is more accurate, because now we have, with the rapid test kits, which I love, by the way, I take them at
Mhm.
home all the time, but it doesn't go reported anywhere. So the
Mhm.
wastewater allows us to be able to gauge where we are as a community. Another major tool that I use is the hospital data. So the hospital gives me data every single week. We also participate in a monthly infectious disease call with the hospital on other infectious disease control efforts, but they also give me hospitalizations, for example, of flu cases versus COVID patients. And that is also a way that I gauge on how we're doing as community. And that's when I start saying, okay, you know what, we need to make recommendations, as I mentioned today, on encouraging indoor mask use
Mhm.
again,
Mhm.
because we're seeing that, 100% increase um, on those different um, tools that I use to assess and gauge where we are as a community for disease. And so, it's really data. It could be boring for some people, but like other people they love data. For me, I'm a data junkie, because I
Great.
like to look at the different ways I can be able to then determine the risk level for our community.
So you are recommending that indoor, if people were willing to wear masks for indoor events.
Yes, I am. So, and obviously, it's not a mandate. It is just a recommendation.
But
Because I get people,
is it a strong desire of yours?
it is, now that we're entering the holiday season and we're gathering together, if we're doing large gatherings, I certainly encourage indoor mask use when you're having these large gatherings. And certainly getting tested frequently if exposed, to making sure that
Mhm.
you're not transmitting any disease as well, because we know that when you are vaccinated, your symptoms can be really mild, almost
Mhm.
like an allergy, and you don't want to be contagious to others. So if you're symptomatic, wear a mask as well, because we want
Mhm.
to make sure that you're not spreading it to others.
Let me drill down a little bit. And I realize that in your position as a public official, and since this is a public show, that I don't want it so much. Oh, Maritza, it's now it's a New Haven mandate that it has to happen. But even but even in and so I'm comfortable in asking questions, and I know you'll answer them to the best of your ability, or you'll say what you're able to say. In schools, should every student is it would be your desire that every student in school, as we speak at Hill House right now, or across where you graduated from
Mhm.
a few years ago, uh,
I wish it was.
should they have on masks as we speak?
So we are encouraging, we provide masks and obviously test kits throughout the schools, and make them accessible too. It is already a recommendation. It has been. And so I have to tell you, Senator Winfield goes around to different schools every single month, and he's always greeting students. And I went with him to a couple of the schools,
Mm-hmm.
and I was really surprised how many students already proactively are wearing masks
Mm,
without anyone telling them to.
mm-hmm.
So I think there's already this sense of like it's an individual choice. And so I always say, be socially responsible. If you are symptomatic, wear a mask. If you feel like you are being exposed, wear a mask, and we can make sure that you have access to masks if you do not have them. And so I am pleased to see that throughout the district, I have been seeing students already being proactive, wearing masks. And so certainly as we enter and seeing cases rise, we just want to continue to encourage people to wear those masks.
And and I really appreciate that answer. The predictions that you're saying, and will those predictions come true in spite of people taking every proactive effort?
I think that it's inevitable that people are going to gather regardless. And so we are projecting that the cases are going to rise because of that. I mean, people are going to get together for the holidays, and it is going to happen. So we are already projecting that it's going to increase because of that. We also know, because there is, individuals are not wearing a mask necessarily in every single social setting because it's not required. It's an individual choice, that viruses are going to continue
Mm,
to
mm,
be in the community. And so the projection is there. We already seen the projection happen, as stated earlier with the data.
mm, mm,
Um, and so, just reminding people to get vaccinated if you have not received an additional dose. Co-administration of flu and a bivalent vaccine is encouraged so that you
mm,
can be protected from both viruses, and protect your family members as you gather with grandmothers and your mothers, aunts and uncles that may have an immunocompromise or some medical condition
mm.
that can compromise them. So, let's think about them as we enter this holiday season.
Indeed. And can you get both shots at the flu and the COVID
You
shot at the
can.
same time? At the same time?
Yep, co-administration is allowable. Of course, if individuals have had prior contraindications or reactions of things of that nature, certainly consult with a provider. But we do. It is approved by the FDA to have co-administration, meaning
Excellent.
you can get both vaccines at the same time.
Yes. We have about 10 or so minutes. So as things cross your mind, or as the spirit might move you, that's the time for that to manifest those visions and dreams that you have. But did you have a dream last night? Did you have any dreams last night?
I did not
How
actually.
about the
I
night
usually
before?
dream. I usually dream. What was I dreaming about the other day? I was like signing off on stuff. It was like really weird. It was really weird. But my kids are always telling me about their dreams, which is really funny. My
What are they?
younger son.
Yeah, what are they saying? This might sound like unrelated to why we're having the show, but I'm convinced that your thoughts and your dreams and your emotions kind of influence your health. I mean, that's kind of a broad statement, and I'll have to do a show on that later. But what do
I
they?
love, when I was in high school, I was so obsessed with dream interpretations.
Mm-hmm,
And I did like a whole essay and research of this back in the day when I had, you didn't have access to the internet like that. And I had to go to the library and actually like do the research, and pulling books. And they recommend that what I learned is that when you do have a dream, that it's important that as soon as you wake up, you write down what you remember and then try to see if there's a correlation, right? But our subconscious mind does somehow link together, and so your dreams are sometimes things that you've experiencing. I can tell you that when I was responding to COVID, I was always having dreams about some response effort that I
Mm.
wanted to do.
Mm-hmm.
So
Mm-hmm.
I've been
Mm-hmm.
trying for the last like since August, I've been really trying to do a lot of self-care
Mm-hmm.
and find this balance between work and personal, because, you know, we do, I was working around the clock literally for almost 2 years um, without any real breaks. And they do that, your personal life and your work life, they just really are interlinked together. Regardless, they're interlinked, but sometimes, like in my case, I um I literally was dreaming about work.
Indeed,
So
indeed, indeed,
I was just like,
indeed.
that's not a good sign. So, but yeah, so certainly, I don't know what I dreamt. I didn't remember what I dreamt about the few, but I remember I was signing like a lot of stuff, and I woke up and, ironically, I was signing. Yeah, I'm always signing things for work, and so, like, I think I signed something like the day before that, and then of course I dream about it. But
And let's just as you were talking, I really appreciate your sharing that, because even your dream state prior to your waking state can kind of impact what you do when you wake up. So it's just, and as you say, writing it down, just in terms of, I think people want to kind of analyze themselves about how to really stay healthy, stay proactive, stay optimistic, and don't be depressed. But I was reading
I
something
don't know.
uh, in terms of asthma. There's some grants that are coming in. You're working on some new projects. Maybe shift to that,
Hmm.
because with whatever the project, whatever you want to say now, it all relates. It's health. It's health. It's health. It's health. It's health.
Hmm.
We have different ways of defining various health stages and diseases, but the comprehensive nature. So share a little bit about asthma and your efforts in that regard.
Yeah, so we have an initiative with our in our environmental section that is led by Rafael Ramos, and we received a grant. It's called the Healthy Homes Grant, and we, in addition to doing lead response effort and getting, lead safe homes, we are also now doing healthy homes assessment on risk levels that may have an impact on asthma triggers. I have a son who has asthma. So, as a parent, over 20 years ago, my son is now 24. He was having these different triggers, and I was new to public health, and I had a healthy homes assessment myself. And believe it or not, you don't realize like things in your home that can actually trigger
Hmm.
just things like, a rug, um, and curtains, or because dust builds up in different
Mm-hmm.
parts of your house, and particles are a trigger to could impact your child's health. A pillow,
Hmm.
or the way that you use to clean your home, and different products. So we do a assessment of different risk triggers, and we also offer resources to get people started. So, like, we may give you a Swiffer mop, for example,
Hmm.
if you use a different mop that may cause dust to come up rather than staying contained.
Mm-hmm.
Um, and so, pillow covers and things of that nature. And so I certainly want to encourage families that would like a healthy homes assessment, to call us at the health department at 946-6999 and ask for the environmental section healthy homes division, and we will make sure that we schedule a home visit where we literally would just be looking for any triggers that can impact. But we know that there are other environmental factors that are impacting asthma in our community. There's a lot of work that needs to be done. We need to invest more resources. And so, certainly, also looking at other environmental factors that can impact our community through different neighborhoods. And so, a lot of things that we're looking at, and we'll be forthcoming with future information on other efforts that we'll be doing, and listening to the community on things that we can consider. Because one of the things that we do is that, you are our eyes, and and living in
Mm-hmm.
New Haven, I see it even when I'm just going shopping over the weekend. We have to also be able to report environmental concerns that fumes that you may see that may be coming out of a building, or things that people may see in the water. Different things
Mm-hmm.
can impact us. And so as a community, we want to remind residents that you can always file complaints or concerns to us, and we will actively uh, activate and go assess that complaint. So I do encourage the community to always inform us, because that is how we can better the community, is collectively we are being socially responsible for the community we live in.
Indeed. And so that number again is
946-6999.
excellent. And even you referenced Raphael. So share a little bit about lead paint. And I'm pushing you here for people to see the connection. I mean, there's so lead paint. Let's jump to that for a second.
So we know that, there, typically homes built before 1978, they are use lead-based products to be able to paint, for example. And we respond to any child that has an elevated blood level greater than 5, between 0 and the age of 6 years old. And that triggers us as a health department to activate and then be able to assess what risk are causing the child's elevated blood level. And the fact that New Haven starts at the elevation blood level of 5 is significant, because until just last year, when the legislation just passed at the state level, most cities across the state of Connecticut did not activate until 20 um, elevated blood levels. And
Mm,
so in the city of New Haven, we're very unique, where we activate early, because we know that it can affect neurological um, factors in our children.
hmm
And so we want to make sure that we protect the child's health as early as possible. And we also support not only the parent and the family, but we also have grants available to abate the lead and
mm,
allow homeowners to be able to participate in the abating the home. So the funds that I receive from the federal government are strictly for those children that are impacted, so that we know that the money is being invested back into the homes where they live. And we also provide relocation support in the event that a child's life is at risk. But I do have to say that oftentimes we don't, when we're doing that, we assess not only the home, we also assess where the child is spending most of their time,
mm,
which is
hmm
another
hmm
family member's home or
hmm
daycare. So we assess like a whole 360 to making sure that we get to the bottom of where the child is being exposed to lead. And just really proud of the team. We launched a lead dashboard. So if you want to see how lead looks like in our city and where cases are actively,
hmm
it's all data that is protected. There's no child's information, but it certainly has a platform where it shows you where we are with cases and the statuses of those different cases, because we want to be as transparent to our
mm.
community. But it is really heavily regulatory. I want to shout out my lead inspectors. They work really hard to making sure that they meet every single deadline to protecting our children and our families. And we know that lead can be detrimental. We have seen some unfortunate cases where chelation has happened, and that is a worst case scenario. So we want to avoid that. So we also have a prevention campaign where we
Mm.
do a lot of lead education. We have community health outreach workers that we have invested as part of the program, because we know that if we can prevent it from happening, then we don't have to get to the point of tracking children. So we are really heavy about preventing, promoting, and protecting. And those are the
That's
three P's that
good.
we always talk about.
Excellent, excellent. And we're going to conclude and kind of with the Vaxgiving campaign. But I wanted to ask, just as you were chatting, also, and thanks for referencing State Senator Gary Winfield, who's so proactive in various areas. For the legislation, the state reps and state senators kind of come together, and the governor again in January. Anything for this next session that you think, from a bill standpoint, for an issue standpoint, that needs to be addressed?
Absolutely. I see one of the things that we're looking at currently, first we're going to be assessing what bills are being proposed, but certainly more funding for local health is something that we're looking at, advocating as a collective through the Connecticut Association Directors of Health. I'm the secretary on that board. And so certainly as a collective statewide, we are going to be monitoring those bills as soon as the session starts. and hoping to put together a legislative breakfast so that we can be able to
Mm.
talk with our legislators about what we do as local health departments across the cities and be able to continue this dialogue on how do we ensure that public health stays at the forefront of the legislators, because they have a lot of competing factors that
Mhm.
are thrown at them from many different angles, which are all important. But certainly we saw how important public health was in the midst of the pandemic, and we want to make sure that we continue to get supported as we continue to protect the health of the community.
I really appreciate you sharing that, because whether we're talking about COVID or flu or diabetes or asthma or lead paint, there's an economic factor involved, and there's a policy involved, and there's money that has to be expended and invested, and citizens have to get the return on the investment. And
That's right.
this show to me is you just kind of illustrated why you're passionate about each taxpaying citizen and just every resident of America getting a return on their investment.
Absolutely.
But we got to work. We got to work the wheels of power and influence and social communion all together.
Absolutely.
Yeah.
And as a community, it's important for us to be aware also, because it can have an impact negatively on us if we're not tracking and staying in tune. And so it's important to, build those relationships with your local legislators all the way to your alders, because you want to make sure that your voice is being represented at whatever level, is including myself as your public servant. As a public servant, I have a commitment and an oath to serving the public, and certainly holding me accountable as well.
We've have about 3 more minutes. Excuse me. I do want to conclude with the vaccine campaign and how to
Yes.
recommend people. But and this is a little bit unfair because it's toward the end of the show. But if I threw out the phrase racism as a public health crisis, would
It is.
so what, when people hear that, so you say it is emphatically, is just as a current soundbite?
So it is certainly a priority for us so I'm going to be launching our strategic plan. As you know, we declared it as a city, and different partners were involved in passing legislation. We've seen the Data Haven report that continues to show in really the history around individuals not trusting even our healthcare system because of the different levels of care depending on race. And, you and I have actually advocated on a lot of issues around health disparities, right? And stemming from race. And so I am committed to it. I have been committed to this for a long time. And so I am launching our strategic plan relatively soon. And that will be at the forefront for the health department as well, and continue to working with our partners and advocating for the public.
Excellent. Well, perhaps we can kind of reconvene and share that.
Absolutely.
In our upcoming show.
Absolutely.
With 3 more minutes, and so Thanksgiving campaign. If you want to be a star, if you want to be a WhatsApp, you want to have a lot of followers. How do you get involved, and what's involved with this Thanksgiving campaign?
As you are as you're getting the holiday spirit, you should get into the spirit of Thanksgiving campaign, where you can enter your family photo, which runs from now until December 26th. And photos can be submitted at nhvvax.org. You can participate and be able to be entered into one of the prizes that will be given away, which is tons of them, including like $100 gift cards to grocery stores, which is really important now as we are gathering for holidays, but also being on billboards or different commercial clips that we will be airing. So please participate, join in the fun. My family participated already, although I will not take a prize. So definitely excited. And remember, on the same website, nhvvax.org, you can also get your additional vaccine for COVID as well as a flu vaccine at one of these locations. So make sure you visit our website for more information.
Excellent. Maritza, thank you so much. Happy holidays. Happy holiday season to you.
Likewise.
Hope to see you soon. And
I'll see you in the community, I'm sure.
Absolutely. Thank you so much, dear. Take care.
Bye.
So that's it, everybody.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing.